Welcome to our special series, Banega Swasth India Goes Global. Today we are joined by a very special guest, Dr. Vanessa Kerry, CEO, Seed Global Health. Dr. Kerry is also the Special Envoy, Climate Change and Health, World Health Organization. Dr. Kerry, as part of our global series, we reach out to students from medical institutions, public health and policy to pose their questions to our experts on the issue that we're discussing, which in this case is impact of climate change crisis on public health. Here is our first breakout question for you.
What are some of the telltale signs we are seeing of how climate change is affecting human health?
Climate change is impacting human health across the world in every possible way. If you look at 2023, we've seen a year that was really punctuated by some of the hottest year in history, extreme weather events, floods, drought in the Horn of Africa that is affecting 120 million people or more. We know that we're on track right now to hit 2.9 degrees Celsius by the century's end if we don't change.
We have another breakout question for you, Dr. Kerry. Here it is.
What is the impact in terms of an increase in disease burden because of climate change? And what, according to you, are some of the major diseases that are being triggered because of the climate crisis at hand?
The direct impacts of climate change are felt through extreme weather events, deaths from drowning, wildfires, extreme heat that impacts people's ability to go to work. We're seeing this in infectious diseases such as rises in malaria, as we saw in the floods in 2021 and 2022 in Pakistan, saw a fourfold rise in malaria, for example. We see it in dengue, where over 60% of the world is going to be impacted by dengue by 2080. We know that climate change is exacerbating non-communicable diseases. That's your cardiovascular health, that is your lung disease, that is kidney disease, that is all the things that that last with us over a lifetime get worse and worse as we are exacerbated by the events of climate change. It worsens mothers' outcomes in pregnancy and increases the risk of preterm birth, and it certainly has an impact on our mental health. So we're seeing very direct impacts of climate change, but there's also indirect impacts. If somebody can't go to work because of the extreme heat, they lose their income, they lose access to food, they lose access to buying medicine. So we also know that in some countries, women and girls are walking farther for water, for example, and they're more likely to be impacted by sexual assault.
What are the challenges that developing economies with large population like ours, which is India, face when it comes to climate change and health goals?
India is one of the most impacted countries in the world. As much as 90% of India's total area now lies in extreme heat danger zones. India lost in 2021 about $160 billion in income. That's over 5% of the country's GDP, really from extreme heat. And that was impacts across manufacturing, agriculture, construction, and various others. This has very real impacts for countries, especially countries that are very diverse too and have large populations or vulnerable populations. What are the challenges? The challenges are ensuring that you can make that population safe, that you have the ability to adapt to the changes that are happening, and that we can build the resilience to withstand these shocks. So in addition to the mitigation that we have to do, because we cannot let this problem continue, we have to realize that climate change is happening now. And even if we stopped everything, we're still going to see the temperature go up a little bit more before we start to see it correct and come down. So adaptation and resilience are going to matter immensely. And we know that on the health impacts that, we're going to continue to see a rise in burdens of disease in every aspect unless we respond. COVID actually taught us a really important lesson. 90% of services around the world were disrupted because of COVID, because we had not put in the investments we needed to strong, resilient health systems that can respond to these shocks. Climate change is going to be COVID and then some, and spread over years. Really must be investing in our primary care and our healthcare workforce, and being able to ensure that the health systems can respond to the climate changes we're seeing.
We have another breakout question for you, Dr. Kerry. Here it is.
What individuals like us can do to fight the climate crisis?
Each and every one of us, in some capacity, has the ability to create change and improvement. Certainly, if you have access to resources, I think there's the ability to think about how to use those resources to invest in the adaptation and resilience. We all have an individual responsibility, to be able to participate in the mitigation and think very consciously of our own household's choices. For those that are business leaders, for those that are political leaders, for those that are in positions of power and really have the ability to influence across scale, I think there is a moral responsibility to rise to this moment and to change how we do business so that we are protecting our community, protecting our future, protecting our children.